back, everybody, to another episode of Vital Stuff with me, Dr. Gail. Today, we're going to meet Dr. Asiyanbola, who is incredible. She actually reached out to me to ask some questions about her entrepreneurial ventures in medical device development, and I became just in awe of what she's trying to do. So I'd love to share that with you. It's an amazing conversation, and she's gone above and beyond what most people will ever do in a lifetime. So hope you enjoy this as much as I did.
How are you doing?
Fine, thank you. Thank you so much for having me.
Oh, thanks for joining us. It's great. Well, when I first met you, I was so inspired by your story and everything that you're doing. I'd love for you to share a little bit about that with us, and, we can go from there.
Okay, great. Thank you. So what I'm doing, I'm actually a surgeon, a surgical oncologist, and but I like and try to develop healthcare devices, particularly for recalcitrant problems. And so one of the devices that I developed in conjunction with engineers was a device to mitigate harm from mass shootings. And as you know, there have been almost 80,000 school shooting deaths since Columbine. Almost 400,000 school shooting survivors who, of course, go on to have their own trauma, increased absenteeism, less likely to graduate from high school, less likely to graduate from college. And of course, the bystanders, the teachers, and the staff who also have their own trauma. So it's a huge problem in society. And so one of the things that I was looking at was trying to see how I could help, essentially. Particularly after Sandy Hook, everybody, I mean, I can talk for myself, felt a sense of helplessness. Like, how can we prevent this, or just make this not happen again? And so one of the things that I came up with, I went through lots of iterations and lots of prototypes and just lots of dead ends. But then we, in conjunction with our talented engineer, we came up with a device that actually, what it does is alters the balance of power between the shooter and the victim. To this day, the shooter holds all the power. You inflict harm on someone else, whether it's justified or not, it's not even part of the equation. It's like, but the balance of power lies with the shooter. So in this device, which is comprised of a materials composite, what it does is it allows for the projectile to be reflected or rebounded back to the shooter, while mitigating the harm to the victim. And so what you have is, if you have somebody who decides, okay, I'm going to shoot up a school today, if they come into the school and start shooting, the same bullet that the shooter intends to inflict harm with, is then stopped and then rebounded in the direction of the shooter. At the very least, it would cause distraction. At the worst, it might cause some damage. And so this technology is different from what is out there because it creates a situation where you have instantaneous sort of an instantaneous effect on the shooter, as well as mitigating harm to the victim. So that was that was the device that we prototyped, and so it was very I think it was very exciting to see that we were able to do that.
Wow, that was an awesome summary, and it's totally amazing. And what I'd love to do is kind of unpack that, because you know, I think there's a lot to be said for the fact that number one, you're a surgeon, right? And so we share that in common, which I love. Number two,
Yes.
the fact that you are not only looking for or acknowledged problems that are unsolved that you're passionate about. And so you are developing basically um, tools to solve those problems. And we share that in common. And I just love how focused you are on solving the problem. And this goes without saying, obviously, you're thinking outside the box. So rather than go too much in depth on the actual technology itself, because I want to be cautious about the fact that, you know, we want to protect those ideas that you have and we don't want things to get out of the bag too soon. But let's talk a little bit about those things that kind of inspired you to not only become a surgeon, so, you know, that wasn't easy, but also what it is that leads certain people to go beyond, you know, the boundaries of, you know, just saying, okay, I'm going to try to solve this massive social problem. I mean, it's quite inspirational. Let's unpack some of that.
Right. First, I must say, you are a huge inspiration. You are, as you said, we're both surgeons, but you are one of the founders, really, of oncoplastic surgery, which is just amazing to me. I went to your course and I loved it. It was very helpful in my practice, and so yes, you are just a huge inspiration to me.
Thank you. Thank you so much.
No problem. But yeah, I mean, I became a surgeon because I liked it. There were no females. I went to medical school in Nigeria. I did my residency here in the US at the Hospital St. Raphael, which is now part of the Yale University's system. But
And can I ask, why did you leave home?
uh,
Because that's a big move in and of itself, right? You have to
right.
have that kind of adventurer spirit to do that.
Yeah, so it's interesting. I was actually born in Scotland and then we moved back to Nigeria. So when I finished medical school, I felt constricted, because
Mm,
there
yeah.
there are there's a lot in medicine and a lot that has been developed over time. Like I always tell the people coming behind, there's a lot of history in whatever we're
Mm,
doing, whatever, like where any order that you write, there's a lot of history, there's a lot of research, people have dedicated their lives to solving those problems, and so there are protocols and all of that, and I just felt a little constricted. I felt like I needed to, for want of a better word, fly.
yeah.
um,
Fly,
and
exactly.
so yeah, and so I of course I went back to England, and then from there I came to the US.
Brilliant. Lucky us and all of your patients. So, yeah, again, I think I've shared that feeling of constriction. So maybe that's something that people who go beyond the boundaries really have that feeling of being constricted and kind of having to get out. And maybe that's why they say out of the box. Um,
Maybe.
Certainly, you know, neither one of us, I think, fit the mold for what a surgeon looked like. Um, and, you know, I never even thought about that. I don't know if you did, but for me, I never thought about that. I just loved doing surgery and I was going to do it no matter who told me that I couldn't do it or whatever. And I'm
Yeah,
so
yeah.
glad I did. And I'm so glad you did.
Right, right. So it was the same thing for me. Um, in my medical school, there were no female surgeons. There were female OBGYNs, but no female
Yes,
surgeons. So, it
exactly.
just didn't occur to me that that could be a career choice. And then when I did my surgical rotation, I just really loved it. And then I went on to do other rotations, and I was like, yeah, I'm going to be a surgeon. And kudos to the people that were my senior colleagues. I mean, there was no thought about not encouraging me to do that. In fact, I joke with one of my mentors till this day because he wanted me to do medicine, and he was like, "Oh, why do you want to become a carpenter?" And I was like, "No, no, no, that's what I'm going to do." Um, and because surgery is much more cerebral than people give it credit for. And so, but yes, it was I just loved it.
I did
That's all
have
I can
the
say.
yeah, I did have the experience of the dean of our medical school trying to dissuade me. No, literally actually saying, "No, you can't do surgery." When I said I wanted to go into surgery, he's like, "You can't do that. That's a man's field." And I was like, "What is he talking about?" And he basically said, "No, you have to do OBGYN if you like surgery." So I actually started in OBGYN and
Okay.
yeah, and cried every day on my way home from work because I really didn't, that was not what I wanted to do. And then someone actually dropped out of the Stanford program and they asked me if I wanted to come over to surgery. So I made a lateral move into the surgery department, which was fantastic.
Great.
But it's destiny. A lot of this is just destiny. And I think, patience and endurance equals your destiny. Um, if you can stick it out, because it's certainly not easy. Nothing that you've been through or that we've gone through is easy. There's no easy way. But if you have a passion about something, you can endure.
Right. Right. Yeah. And, I sort of warn the people coming behind me. I'm like, it's not an easy road by any means. And, you know,
Lots of
but
sacrifice.
yes, lots of sacrifice. Yes, absolutely.
So let's talk a little bit about the medical device piece of this because, the surgical stuff is a career in and of itself. And I had a parallel career in medical device development, which was, I was very fortunate to do that. And as a clinician, I could easily see gaps in tools that we needed for breast in particular in women's healthcare because it was so archaic. So there was a lot of opportunity. It was all upside.
Right.
Um,
Right.
and those things kind of present themselves. You're taking on a number of different projects, but this one in particular includes a social cultural component that we have no control over. It I think you could classify it as a disease in many respects. Obviously, mental illness plays a role. Um, it's definitely out of the box, and I want to know what kind of sparked you to actually do something about it because we all think about it and hate it, and there's a lot of politics and legal stuff around it, but you actually said, no, I want to create something that's going to make a difference. Talk to me about that.
Well, it's difficult to pinpoint one particular time. But I do remember the sense of despair after Sandy Hook. The fact that it was just like I could see this going on and on and on, and just thinking about, and I love history and reading about the people that came before us and things like that, and so just looking back at the history and um, you know I I think I also empathize with the victims. I mean, it's like,
Mhm.
you're a child and you go to school and you're just shot. I mean, it's and then I started empathizing with even the shooter. I was like, they must be so confused, and like, what makes somebody do this? Like, get up
Hmm.
and just go and start shooting children. Like, it doesn't even, it's almost beyond something that I can comprehend. And so I just felt sorry for like everybody concerned, and that usually sparks it a little bit.
I think
just
that's, I
just
think
the
that's,
just that.
I think you've really touched on, perhaps what even made us go into medicine. It's that empathy, compassion. Like you said, without boundaries, you even had empathy for the shooter sometimes. I agree. I cannot comprehend it. To me, I cannot comprehend hurting another human being like that. Like, I mean, in really any way. Um, so that perhaps is the spark of innovation for us, as physicians. It still
Yeah.
starts with empathy.
Yeah.
And trying to change the experience, right? Trying to, well, in this case, stop it. For me, a lot of it was trying to decrease pain or, make the experience more humane, because some of what was done in medicine was quite barbaric, really, and still is in some specialties. So I think it's that common feeling, sense of, can we do something better to make life better for other people? Um,
Yeah. Yeah. That's correct. And then with to add to that, a healthy dose of frustration. Like, it's like, there has to be another way. There has to be some other way. We are we're missing something. We have to, there has to be another way. And so, yeah, you get the healthy dose of frustration with the way things are, and so that also sparks the thoughts
and the call to action.
and the call to action. That is correct.
Yeah, brilliant. It's so amazing, really, what you're doing. Um, any other thoughts on kind of the whole being a physician, yet being an innovator and an entrepreneur, and those challenges, um, compared to the daily challenges of being a clinician in today's American medical system?
I think it's actually much worse for people like us because um, it's we it's hard to accept the level of sometimes the technology that is available, and thinking, oh yeah, I can design something so much better, and things like that. So I think it's much harder for people like us. I think if we were not people like us, I think we would have an easier time accepting um, the state of things. um, but yes, it's like constant.
I agree with that. It's like accepting mediocrity is just not an option. And maybe that is what drove us into surgery as well. It's kind of like, here's a problem, we have a way we can solve it. Let's get on with it. But I'm curious if you feel the frustration of how long it takes to actually develop things, um, everything that's involved from the legal aspects, and the bureaucracy involved around um, development. Because I certainly had no clue. I've been in this field for 30 years now, and ultimately had to make a choice of leaving clinical medicine, to focus on medical device development, because it just was so intense and so time consuming.
Yeah, I would agree with those thoughts, because number one, when you develop something, particularly if people like in positions like such as ours, you feel that you sort of know some of the downsides, and you want to make sure that they do not ignore those in the pursuit of profit. Um, the other thing too is that I think that a lot of us are able to, I mean, we don't just design one device. I mean, there are so many problems in like the world that, whatever situation we're sort of thrown into, I'm sure we can come up with ways to do it better. And so I don't think that there's as much ego and as much invested in a particular device.
Mhm.
And I think that's one of the problems that I see around me is like, if you're invested and you are so committed to one particular device, you will do everything and anything possible to promote that, even if it is not the best device to help that particular patient. And so that is a huge problem that I see. And it's up to us to fix this. I mean, we cannot have other specialties run medicine. We're the physicians. We're supposed to do no harm. That is our mandate. And so, if you have a piece of technology or a drug or whatever it is that is new, you should be open to having that technology or drug uh, be open to correct trials, and if something better is available, you bow out. Your whole reason for being should not be tied up in that just that one device or drug, to the extent that you will do anything to promote it. And so um, that's one of the things that I see is an issue.
Do you have any examples of that? I have one I'm thinking of in particular.
Please
Um,
tell me.
I'm curious to know if it's the same thing you're thinking of. You go. Or shall I go?
Uh, you go. You go.
Okay. Okay, it's another massive problem, I would say global problem, and that is obesity, which, it's a massive health problem staring everyone in the face. And there's a cascade of other health problems that um, come from that, including heart disease, diabetes, we know the list. And the GLP-1s obviously have revolutionized the field of obesity. Okay, we know that there was an era, I would call it an era of the last 20 years or so of obesity surgery, right? And those surgeries were not successful unless it was combined with a comprehensive program of behavioral modification, nutritional dietitians. You have to, as with everything, you really have to take care of the whole patient. The GLP-1s are extremely effective, and I have noticed that they were really, really expensive. And now I see that somehow they're being marketed in two different ways. One is a prescription that is paid by insurance or is paid in cash. And the second is roughly, I don't know, at a lower price or something, but it's marketed directly to the consumer. So I think we're going through an interesting path right now with medicine and the pharmaceutical industry. And I'm watching this very closely because I don't know if it's necessarily the best thing for patients. And I'd love to hear your thoughts around that.
Right. So let me preface by saying I'm not a bariatric surgeon or an metabolic physician, but I will say that I agree that it's an interesting time, and obviously, there have to be trials, side by side comparisons, and and I think that whatever turns out to be the best for the patient should be what is promoted. Um,
I think there's
yeah.
no easy path because the cat's already out of the bag. Um, and Yeah, it will be interesting to watch because my background in endocrinology has taught me that you can't do anything without there being an equal and opposite reaction to that. Um,
Reaction, right?
so, I don't know. I'm still waiting for the other foot to fall on the GLP ones, but
Right,
it is one of the things that really has inspired me to get more involved in self healthcare and people
right,
taking better care of themselves.
right,
I, you know, I try to start with myself as an example. And a lot of my friends who I'll go out to dinner with and family, they will say to me, "Oh, you can ruin any delicious meal."
oh my goodness.
because, because it really does start with what you eat,
Right,
you know.
right,
And I've learned that over a long, long road, and all the old sayings are true. You are what you eat, you know.
right.
Um, so anyway, that is my new path, is kind of exploring how we can all just be our best self in terms of health. Genetics plays a large role, so we can't control that, but we can control our diet and exercise and our mental health, which is a huge problem and leads us right back to where we started. We've got to change, and you are taking the bull by the horns on this one. We've got to change this whole situation with um, the mass shootings. And I love what you're doing. Just that and many other things. And I just appreciate having a chance to chat with you today, just kind of freewheel it and hear some of your thoughts. And I think you're inspirational and amazing. So thank you for your time today.
Thank you so very much for having me.
And we'll have you back because there's so much more to unpack.
All right, great.
And we want to watch
Great.
your
I'll be happy to
progress
come back.
too. Yeah.
Yes, I'll be happy to come back.
Oh, that would be fantastic. Okay, well, we'll watch your career closely as you
Okay.
change the world for all of us.
Okay. Thanks.
Thank you so much.
Okay. Bye bye.